Hi guys, it's Dave. Today we're going to talk about antibiotics, or also the lack thereof. Antibiotics are used to treat bacterial infections. From the first time that penicillin was discovered around 1928, we have had the ability to treat infections caused by bacteria. The issue is now we have a lot of people that get sick, they go to the doctor expecting to get a prescription because that's the mindset, pill for every ill. And so sometimes we go in and we do get an antibiotic. Sometimes we go in and it's not, the condition you have is not treatable with an antibiotic. In that case, it's best if the doctor or your provider doesn't give you anything but gives you some advice on how to just handle the infection that you're dealing with or the disease state you're dealing with at home as best you can. If you have a virus, which there is a lot of viruses going around this time of year, upper respiratory, gastrointestinal, you have things like the flu. An antibiotic, it does not treat the flu. Yes, you can get an antiviral such as Tamiflu or Relenza, and that will help to treat the flu if you meet the qualifications for it. But antibiotics do not treat viruses. They also don't treat fungal infections. So that's something else to remember because it's not very common, but you can come down with a fungal infection either on your skin, which is the majority of the places you see it, or inside of you, in which case you would need a fungal medication to take care of it, but not an antibiotic. There was a wise old provider in the Sandhills of Nebraska that when I was just a little one, you would go in and if you needed an antibiotic or a prescription, he would write you a prescription. However, if you didn't, he had two jars. One had blue M&Ms in it, one had red M&Ms in it, and you got to choose. Point being, you came, you went to the doctor, you left, you got advice, and you actually got something for the visit. It was far better for him to do that than to unnecessarily prescribe a medication that would not take care of your situation or your infection. Because that is a big risk right now is the overuse of antibiotics. If you're given an antibiotic for a disease state or for an infection or for a virus, and the antibiotic will not work for that, all that you're doing is increasing the chance of you being resistant to that antibiotic when later on in your life you may actually need it. So you take it and it's not effective because you were given an antibiotic when you should not have been. So remember, if your provider or your doctor says, no, you don't need an antibiotic, but go home, get some rest, get hydrated, take some vitamin C and D, that's absolutely fine. They have your best interest at heart. Some do's with antibiotics. First off, take them as prescribed. If it says take it twice a day for 10 days, take it twice a day for the full 10 days. A lot of courses now are shorter than they used to be. So for some things, you may see it for 7 days. You may see some for 5 days. Make sure you take it for the amount on the prescription. If it says take until gone, you take it until it's gone. If you happen to have a reaction to it, absolutely let your doctor and pharmacist know so they can document that and maybe change the antibiotic. Another do, if you have questions about why you're getting that antibiotic or how to take that antibiotic, talk to your doctor, talk to your pharmacist. There are a lot of antibiotics that you need to take with a lot of water. Maybe you need to take it with food. Some you need to take on an empty stomach. Make sure you're educated before you leave the pharmacy. The other thing you absolutely need to do is to make sure the doctor you're going to, because now we have telemedicine, quick care, so they may not have your full medical history. Make sure you tell your doctor and your pharmacist about all the medications you're on and your allergies. That way they won't prescribe you something that you're allergic to. And also, they won't prescribe something that will have an interaction with one of your other medications. Several antibiotics interact with heart medications, and it's very important that your providers know about the fact you're on a heart medication. The other thing is, antibiotics can affect your birth control as well if you're a female. So they need to know you're on that birth control because antibiotics can decrease the effect of birth control. The other thing that you need to remember when you're on your antibiotic is do not share that antibiotic with family members or friends who come down with the same symptoms. As far as don'ts, don't take leftover antibiotics. First off, like I said, use all the antibiotics up, take them as prescribed. So if you have leftover antibiotics, you already have one mistake. But just because an antibiotic worked a month ago or a year ago does not mean it will work again. So don't take leftover antibiotics. Secondly, don't take them other than as prescribed. So if it says twice a day, don't say, oh, I think I'm going to get 3 in today because I feel bad. Stick to exactly what the doctor wrote on the prescription. There are some cases where you can make up a dose with a certain antibiotic if you're getting that prescription later in the day. But before you do that, make sure you talk to your pharmacist. They'll let you know. The other thing is, don't be afraid to ask questions. Before you leave your provider's office, make sure you're educated about what they've given you. Before you leave your pharmacy, the same thing. Make sure you're educated about the antibiotic or any prescription that you've been given. So this winter, just because you're not given an antibiotic prescription, don't stress. You may not qualify for it. In that case, make sure you go home, you get lots of rest, lots of fluids, especially water, and push the vitamin D as in dog and C.